The priority is keeping campus learning an option. Does something else have to give? Do medical experts think the additional funding for hospitals and available testing at airports that would be not mandatory but an option going far enough? Joining me this morning is Dr. Ross Goldberg, president of the Arizona Medical Association and District Medical Group Vice Chair of Surgery at Valleywise Health. So thank you so much, sir, for joining us this morning. And I know it's a busy time for all in your field. So we're talking today as we've just really passed a very grim milestone across the country. More than 250 Americans have lost their lives to COVID-19 during this pandemic. What is your perspective from the hospital right now? Did you think that it would go this far?
Well, first, good morning. Thank you for having me. Yeah, the 250,000 dead Americans is a number it's hard to fathom. From the hospital standpoint, we are seeing an increase in numbers. I'm hearing that across the state. The numbers, obviously, the new case reports are concerning, the increase in the percent positivity, the deaths. All of this is going in the wrong direction, and it really is on all of us to try to stem the tide now and slow things down.
90% capacity in the ICUs. We spoke yesterday with a doctor that said maybe this means we'll move into kind of an emergency scenario where you'll be putting hospital beds in spaces that are not actually hospital rooms and doing what you have to be able to accommodate more patients. What changes in the future in the weeks and months ahead do you predict, and what worries you most?
Well, honestly, what I'm more worried about is the staff and the resources. You know, you can have all the physical beds you want. If you don't have the people there to take care of them, it doesn't really matter where you put the beds. I worry about running through our staff. Across the country, people are looking for resources, so there is no out-of-state resource that we can tap on. We have to rely on what's in state, and it really is on everyone, again, to help try to slow this down. If people keep on, and not everyone is following the rules, if everyone needs to follow the rules so we can try to slow this down. My biggest concern is the resource availability and burning through our healthcare workers, because there are no backups and there's no second team ready to go. We're all working at a very furious pace for months now, and we need to get a release valve somewhere.
Wow. I know that you were listening to the governor's news conference, the first time we've heard him answer questions regarding strategies for COVID since October. What were your thoughts about not extending a statewide mask mandate or making any changes regarding the way that businesses are currently operating? Were you expecting more, hoping to hear more to slow the spread?
Well, it's hard for me to, from a public health standpoint, it's kind of easy for me to say what I think needs to be done. I don't have the responsibilities of the economic and every other impact that comes into it. I will say that one point I agree with is that it falls on everyone to be responsible for wearing the mask and doing the physical distancing. I have personally seen numerous times people ignoring this mask mandate. We have one for Maricopa County, and people are still ignoring it. This is not a some do it, some don't. Everyone needs to buy in and do this. We have shown it works. So the problem really isn't the mandate, it's the enforcement, and it's following the rules. If people would do that, I think we'd have a lot better chance of keeping things open. I agree the schools should be one of the last things to be closed. We should look at other businesses. I think if there are bad actors out there, they need to be held accountable. But I also don't want to punish those that are following the rules. But the trick is that we all need to play our part and do the responsible thing, wearing the mask, social distancing. Look, I'm doing a Zoom Thanksgiving with my family. I haven't seen my family in a year. I really need everyone to kind of work on this and follow these rules. If people ignore it and be selfish, frankly, we're going to continue to have this problem.
Dr. Goldberg, that is a very powerful message, and we appreciate the sacrifices that you're making personally and also professionally. And we want to share those messages to do whatever we can to support these efforts in a time that just is exhausting, I'm sure, for your industry and the community. So thank you so much.
My pleasure.